Hey guys, welcome back for another week of Work It Out Wednesday. On Wednesdays we work out practice questions to test our knowledge on topics that we have covered. This week we have covered the diagnosing of Addisons and Cushing's disease. So let's get into the first question. A patient presents to the office for follow-up, and while reviewing their labs, you note an increased cortisol level. You are suspecting Cushing's disease. As the nurse practitioner continues her assessment, what will be the next best action? A, refer to endocrinology for further treatment of Cushing's. B, assess the patient's medication for glucocorticoids. C, this is normal, no changes are warranted at this visit. Or D, have the patient return in 1 week. I'll give you a second to think on this and post your answer in the comments. All right, you guys, I always tell you read the stem of the question first so that you can ensure that you are answering what they are truly asking you. So the stem of the question states, as the nurse practitioner continues her assessment, what would be the next best action? So what should you do next, right? So would you refer to endocrinology? Yes, endocrine is the specialty that handles Addison and Cushing's, but we're not to that level yet. B, assess the patient's medication for glucocorticoids. Yes, that's a good idea because remember when we discussed this, when you're looking at the cortisol level uh, being elevated and you're starting to consider Cushing's, you want to go through those patients' medications and rule out that they're on a glucocorticoid that could be contributing to their elevated cortisol level, right? So you start with the least thing, right? So we want to make sure first if they're on glucocorticoids because that's an easy fix before going down the entire rabbit hole of Cushing. So your next best action would be to assess the patient's medication for any glucocorticoids. Got it? All right. Next question. A patient returns to the office today ready to proceed with the treatment for Addison's disease. At the previous visit, she stated that she wanted to wait and discuss starting any new treatments with her husband first. She is now ready to proceed. How should the nurse practitioner treat? A. Initiate an oral corticosteroid. B. Initiate Rocephin. C. Initiate radiation therapy. Or D. Explain to the patient that since she decided to wait, you cannot prescribe any treatment. All right, you guys, I'll give you a moment and tell me what you got in the comments. All right, you guys, stem of the question states, so now that she's ready to proceed with her treatment, how should the nurse practitioner treat? So we're thinking about Addison's. How do we treat Addison's disease? Do we want to A, initiate an oral corticosteroid? Okay, yeah, that's a treatment. B, initiate Rocephin? No, don't need any antibiotic therapy. C, initiate radiation therapy? Thinking about that, but remember that's with Cushing's disease. That's one of the potential treatment options. And D, explain to the patient that since she decided to wait, you cannot prescribe any treatment. We're not saying that to a patient. So your choice is A, initiate an oral corticosteroid, and you guys go and be familiar with the ones that you treat because on boards, just in case they give you the actual medication name, like Cortef or something of that nature, that you are familiar with that. You can also do hormone replacement therapy. We do the oral corticosteroids, and just be familiar with the drug class and name as well, so that you don't get caught up or miss something that you do truly know. Okay. All right, you guys, as always, like, comment, and subscribe. It's free to subscribe and it gives you notifications every time that I do videos, but it also helps me as well. So please do so and share with a friend or colleague who may find this helpful. But make sure you meet me back here next week for some more practice questions for Work It Out Wednesday. Bye, y'all.